Assalamualaikum. Hi, my name is Izzah and I'll be presenting regarding the koi herpes virus KHV that is common among kois. So this is a video of the koi. You can see it's a very popular ornamental fish. So let's talk about koi herpes virus, or known as carp interstitial nephritis gill necrosis virus. It is a double-stranded DNA virus from the genus Crypinivirus, and in this case is the Crypini herpes virus strain 3. So there's 3 strands of this herpes virus, named 1, 2 and 3, and in my case the affected agent is going to be Crypini herpes virus 3, that is the affecting the kois. So next, let's talk about hosts. So there's 2 common hosts that may be affected, which is the common carp and also the koi. So these 2 are amongst the hosts that can be affected. So what about the predisposing factors? So there's 3. In this case, this is water temperature, the stress, and also overcrowding. All of these 3 factors can cause the koi or the fish to be infected. So this is the distribution, where you can see that it is highly infesting in the North and South America, Europe, and also Asia. So this is the most reported case by the OIE, and the mortality rate is influenced by the virulence of the virus, the age of the fish, and the temperature of the water. So the mortality rate is the highest 48 to 72 hours after the first onset of clinical signs. So what are the clinical signs? So the most common one are the gill necrosis, ulceration, pale patches, and sloughing of the scales. All the others can occur as well. However, those that I mentioned are the one that is, say, pathognomic or common lesion that can be found in the koi herpes virus. So what samples that can be taken? We can take the gills and also the spleen and the kidney as labeled in the picture there. So all of these can be taken. It must be fresh and not decomposed carcass. So the fresh will have the virus particle. So what we can do direct and indirect. We can do real-time PCR and also ELISA. So these 2 are currently the best way to detect koi herpes virus. Unfortunately, sadly, there is no treatment for koi herpes virus. Therefore, supportive care is needed. Can do is increase and decrease the water temperature, increase the salinity, increase the aeration, also prevent secondary bacterial, fungal, and parasitic infection. There are 2 types of vaccination, which is the oral probiotic vaccine and also live attenuated vaccine. And with the live attenuated vaccine, it can be differentiated using the T4 by PCR. Therefore, prevention and control is very important. So first, for introduction of new fish, it must be from a disease-free source and quarantine with sentinel fish for about 4 weeks to 2 months. And after that, when there's no clinical signs present, it can be transferred to the main koi ponds and no infection occurs. The eggs can be disinfected using Ovidine, and also the farm equipments can also be disinfected before and after use. And the fish handling must be minimal to reduce stress, and also for that, carcasses need to be disposed properly. So that's all. Thank you for watching.